height, this should be relatively easy to palpate. I'm going to put your shorts up, that's okay? Okay. All right, whatever's in your pocket is just like limiting this. Okay. So hamstrings are probably one of the easiest palpations because they're pretty big and they're just, I don't know, they're just easy. All three of the hamstrings originate at the ischial tuberosity. The only exception is the short head of the biceps femoris does not cross both joints. All the rest of the hamstrings, the long head of the biceps and the semimembranosus and the semitendinosus all originate at the ischial tuberosity. The posterior linea aspera or lateral lip and linea aspera, you're not actually going to palpate that, but it's going to start down in here. That's the short head of the biceps femoris. So they all start here, ischial tuberosity, and then if you come laterally, this is biceps femoris. Comes all the way down, bend your knee. This big tendon right here, biceps femoris, all the way to the fibular head. So you can pretty much palpate all of the biceps femoris, all of this. And the short head starts about there, but you're not going to pick up its actual pinpoint origin, but it's the lateral lip of the linea aspera, deep. The long head is up here on the ischial tuberosity. The semimembranosus, semitendinosus, again, start ischial tuberosity, and they come down. And the differentiation here is where they insert. The semimembranosus is going to stay posterior and attach on the posterior medial tibia, versus the tendinosus is going to come around with the rest of the pes and serine to attach on the anterior medial tibia. So they're going to split right here. Bend your knee. So the big, thick one that you feel on most people, that's the tendinosus, because it's kind of like a guitar string. It's very stringy. And you can feel the direction that it's going to the anterior side. Versus underneath that is the thicker, wider, bigger one, but it's flatter, is the membranosus, and it stays to the posterior side. So this one is the tendinosus, and the one underneath that, and I can feel it on both sides, is the membranosus, because it stays here. The tendinosus goes to here. Okay, do this side. Bend your knee. This is gracilis. That's his tendinosus, because it's going to go to here. His membranosus is under that because it stops right there. Okay, so origination of biceps femoris is long head is ischial tuberosity, short head is lateral lip and linea aspera, insertion is fibular head. The biceps femoris is a hip extender and a knee flexor. They are sciatic nerve L5S1S2. Oh, long head is. Oh yeah, this is one that's different. Long head is sciatic nerve S1 to S3, and short head is common peroneal nerve L5S1S2. The rest of them, the rest of the hamstrings are sciatic nerve L5S1S2. Semimembranosus and tendinosus, both origins are ischial tuberosity, coming down to posterior medial tibia for semimembranosus, anterior medial tibia for tendinosus. Both of them also hip extenders and knee flexors. And then the glutes. Glutes are easy. Glutes are posterior sacrum and ilium, so all of this, so whether you come this way or you come this way, it doesn't matter. Can I untuck your shirt? I'm going to go underneath your shorts, okay? Okay. It's all of this coming down to right there. So I think your card, posterior femur, distal to the greater trochanter and the IT band. So if you know where your IT band is and your greater trochanter is, that's where you're heading. It's right about there. Hip extender, it's not sciatic nerve though, it's inferior gluteal nerve. This one is too. Hip extender, hip hyperextender, and a hip lateral rotator. Because of its orientation this way, it has a little bit of an external rotation piece as well. Although that's not its main job, it has a little one. Okay, so if I want to differentiate out hamstrings versus gluteus maximus, what do I do? If they both extend the hip, how can I differentiate out?
Hyperextension.
Okay, if I bend his knee and then have him extend his hip, lift your foot towards the ceiling. Is that glutes or is that hamstrings?
Well, if his knee's bent, that's hamstrings.
You're putting in passive insufficiency or
okay.
active insufficiency.
Mm-hmm. You bend his knee, now you have short, you just made the hamstrings actively inefficient. So again, this is kind of like the hip flexors. You're not going to completely isolate one or the other, you're just going to bias it one way or the other. So if you do hip extension with the knee flexed, it's more glutes. If you do hip extension with the knee straight, lift your whole leg with your knee straight, that's more hamstrings. Okay? So concentrically for hamstrings, you would keep your knee straight and lift your whole leg off the table. And then you would resist here. Keep holding up as I push down. Again, I would, body mechanics wise, I would not be sitting. I'm just doing this so you guys can see. I would be standing because his hamstrings are really going to be really strong. And then push down as he continues to push up. For hamstrings, for glutes, have him bend his knee, lift your foot towards the ceiling. Concentric, pushing down as he continues to push up. Eccentric.
Now he's having trouble moving the leg. Does that matter during it, or as long as we demonstrate it like that, that's good? Or does the person actually have to like go through the motions?
What do you mean?
Like when he's raising, it's like, see how it's like.
Well, hip extension range of motion is not that much.
Okay.
And technically, what you're doing here is hip hyperextension. So it's not that much. It's maybe 20 or 30 degrees. And he's got just a lot of muscle bulk, so it doesn't look like he's moving very much. It's just because he's got a lot of soft tissue. He's got a lot of quads there.
Okay.
So it doesn't look like he's moving a whole lot, but he is. So yeah, you just want him to clear or be obvious that he's, activating the muscle.
Okay.
He needs to activate it.
Do you want us to stabilize this leg and push down?
Stabilization for these are usually the back because people will tend to do this. So I would stabilize here. So I would be here, lift your leg straight with your knee straight, hold that. And then bend your knee, lift your foot towards the ceiling, hold that. So to protect their back, I usually will stabilize here. Okay? We're going to talk about hamstrings again with the knee because you can bias one side or the other when you're talking about knee flexion, but we'll get to that when we get to the knee. This is specific for the hip. So origin, insertion, actions, innervations, differentiating out, concentric, eccentric, whether it's glutes or hamstring bias. Everybody good? Okay, cool.